My name is Tjitte Verbeek van Buuren. I'm a GP, general practitioner here in Groningen. First, I want to introduce myself a little bit more, so you know who I am. Well, as I said, my name is Tjitte Verbeek van Buuren. Tjitte is a Frisian name, so one of the northern provinces is called Friesland, and there's where I was born and raised. I'm now 35 years old, and I'm married and have 2 children. But I'm inhabitant of Groningen for a long time already, since 2006, because then I started with my study of medicine here in the city of Groningen. And it was not only in Groningen where I stayed, because I did some internships abroad as well. So I feel very connected to the international community. I did some internships in England, in Nicaragua, and the United States of America at the UPenn. And after my studies here in Groningen, I did a PhD here in Groningen at the UMCG, at the gynecology department and the psychiatry department. And thereafter, I stayed in Groningen for my general practitioner traineeship. That's a training of 3 additional years here in Groningen as well. And well, right after finishing my GP training, I started my own practice in the city of Groningen, and that's now already 5 years. Well, my practice is located in the city center. As you might see here, it's at the south of the city center, very close to the Grote Markt. First, it was only a GP practice, so only me and my assistants and a couple of nurses. But since a little less than a year ago, we moved to a different location at Radesingel number 6. And that's quite a big building, and we now don't only have the GP, but as well as other services. This is the building we're now in, where we are located with the practice. It's fully maintenance now because there's a lot of work to do. It's an old school building. But there has to be a big renovation to make it suitable for a GP practice. So we now are located at the back side of the building, and in a couple of months we move to the front side. So then the complete renovation will be finished. First I'm going to explain a little bit more about what is actually an huisarts. What is the Dutch word for GP? Well, huisarts, it sounds maybe a little bit like someone who is specialized in arts, like paintings, or something connected to houses or building maybe. But it's not that. A GP or general practitioner is more like what is known to be a family doctor or a family physician. In America they call it general practitioner as well, but in France they call it more like a doctor for the family, or in Germany it's called Hausarzt. But in Spain or in Italy they have different terms as well. So there are many terms for my practice. But that's all a little bit different from other countries. So it's not everywhere. It's not the same as it works in the Netherlands. So I think it's good to explain a little bit more of how it really works, the healthcare system. Because in the Netherlands, your GP or family physician has really a central role in the healthcare system, in the whole medical care in the Netherlands. For most people, it will be the first point of contact when you have any medical complaint or any question, both regarding physical and as well as mental health, and as well as also like the gateway to specialized care. So if you want to go to a hospital specialist, you first have to go to a general practitioner. And the general practitioner can do a lot by itself in its own practice. But if necessary, they can coordinate the referral for you and help you to go to a hospital. Well, in the Netherlands, of course, we do have hospitals, many of them. Here you see a small map. And in the north, you see multiple hospitals. We have in Groningen, for example, the UMCG, the University Medical Center of Groningen, which is really an academic medical hospital, so really for the more complex help. But we do have a Martini Hospital as well in Groningen. That's like a regular hospital. But you have, for example, in Drachten or in Assen or in Scheemda, there are more hospitals quite close to Groningen. And those hospitals, of course, have ERs, emergency rooms for really the big emergencies. They have diagnostics like radiology, for example, X-rays or ultrasounds they can perform there. And of course, they have medical specialists, so the gynecologist, cardiologist, pediatrician, and so on. And the hospitals cooperate with the ambulance care, especially for the big emergencies, of course. But next to those hospitals, there are public health services. They call it GGD, GGD in the Netherlands. And those public health services are located in several places as well. In Groningen, you have those as well. And the public health services are many as well. For example, you have preventative care for the children from baby until 18 years old. That's called consultatiebureau. And when they're a little bit older, it's called a schoolarts or a school doctor. And in that consultatiebureau, children get, for example, vaccinated. And they monitor the growth. Also, they provide corona vaccinations for COVID. And they do pest control and tuberculosis testing when you've been to countries where tuberculosis is something. So that's something what the public health service does. Well, there's another part of the healthcare system, that's the mental health care. That's called GGZ, geestelijke gezondheidszorg. Really the translation of mental health care. And that mental health care is quite complex, so I wouldn't go too far, but it's good to know a little bit about it. You have like the social work that's from the municipality. That's in Groningen, it's called Wij Team, or Wij Groningen. They can help you with, let's say, minor issues. For example, if you cannot clean your house properly, or if you have financial problems, or you cannot, go around with your neighbors, for example, you have minor issues, they can help you with that. And it's for free, and you don't need a referral. So you can just go to the Wij Groningen and they will help you. When it's a bit more severe, for example, when you have a depression, or you have an anxiety disorder, or you have a post-traumatic stress disorder, then you have the basic GGZ or basis GGZ. And there are multiple practices for them in Groningen. For example, PTG, Psychologist Team Groningen, or Max Ernst, or well, there are several places in Groningen where you go to, but for that you do need a referral from a GP, because otherwise it will not be covered with your healthcare insurance. You do have specialized GGZ, so specialized mental health care, and that's especially when you need a psychiatrist, because the basic GGZ is always a psychologist, and a specialized GGZ can be either a specialized psychologist or really a psychiatrist for prescribing medication. And there are several institutions for in Groningen as well. and they cover as well the long-term mental health care. And next to that, we do have psychologists in the general practitioner's office, and that's called a POH-GGZ. So that's praktijkondersteuner huisarts in the GGZ. And that's mostly a psychologist as well, or a psychiatric nurse, which is working under the supervision of the GP. And in most practices, you can go there for free as well, because it's fully covered with your healthcare insurance and costs you no own risk. But it's mostly not for the long term or the more complex cases. However, sometimes the GP helps, or the POH-GGZ will help you to find a specialized care or a basis GGZ. So it can be like a step in that process. And sometimes they can help you as well when you have to wait for a long time, because that's a downside of the mental health care in the Netherlands. Sometimes you do have to wait for a month to get started with a psychiatrist or a psychologist. And then the psychologist in a GP practice can sometimes help you in the meantime to help you with your symptoms. Well, then you have the verloskundige. That's the Dutch term for midwifery. When you want to become pregnant or you are pregnant, then you can choose your own midwifery clinic. Just as you choose your GP, you can choose your own midwife. So it's not that it's connected to any GP. You can just choose your own. And I think it would be preferable to have a midwife who speaks English as well, of course, if you don't speak Dutch yourself. And the midwife will guide you through all pregnancy related questions from the start to 1 or 2 weeks after giving birth. So they do all the blood checks, the ultrasounds, all the other questions as well. So that's really an advanced care as well in the Netherlands. And they do provide help with giving birth as well. So really, what can be done at home in some cases or in the hospital. And if it gets more complex, they will refer you to the gynecologist. But if you have any more questions about that, it's always welcome to visit any GP because we're more than happy to help you with that. Some other thing is the district nurses. It's called thuiszorg in the Netherlands. It's for people who need help in their homes, for example, with cleaning themselves or with wound care or for the elderly. So they can help you at home. Of course, we have the dental care. It's called tandarts in the Netherlands. Like the midwifery clinics, you can just choose your own dentist. It's not connected to any GP, so you can just choose your own with a good review or with English-speaking dentists. So you can just choose whatever you want and pay attention to what is covered with your healthcare insurance, because not all care what they provide is fully covered. So question that beforehand. And of course, you have various other therapists, like physical therapists, dietitians, or logopedists. So there are only many other therapists. It's always good to check beforehand if it's covered with your healthcare insurance, but because it's not always the case, and sometimes it's only the case for a couple hours a year. So, for example, a dietitian is only covered for 2 years in the basic package. And if you have an additional healthcare insurance, you have many more hours. But it's good to be aware of the cost beforehand. And for most of those therapists, you do not need a referral from a GP. So you can just visit a physical therapist or a dietitian or a logopedist to get any care from that. And of course, you have the general practitioners. Well, it's a lot. So I thought it might be handy to have a little bit of a guideline where to go or where to call with. Well, first, most important, when you have like a major emergency, for example, a car accident, or you are seriously wounded or injured, or you have uh, somebody who is unconscious or is severely bleeding or has pain on the chest or is suffocating, of course, you have to call an ambulance. And in the Netherlands, that number is easy. It's 112. So save that number in your memory. It's 112 to call an ambulance. And when you call the ambulance, you will get a nurse, a specialized nurse, who will ask what is going on. And if there's really a serious emergency, then they will send one or two ambulances right away. But it might be that they say, well, the case that you're telling me is not severe enough for an ambulance, and then they can guide you to a GP. So we cooperate with them a lot. But well, first they will, of course, check if it's needed to send an ambulance. And then if you do get an ambulance, then still it is possible that they help you and say, well, luckily the pain on your chest, for example, is not a heart attack. So you can just relax, and you are advised to go to a GP later that day. And mostly they will call us then as well to make an appointment or to help you to get to us. Well, of course, you have minor emergencies as well, like a small wound or asthma attack or a baby with high fever or any other minor emergencies. For that, you can go to the GP. The GPs in Groningen, we have a lot of them. Our clinic is, of course, one of them, but there are many others as well. So you can just search on Google which one is close to you or which one have good reviews or speak English or take new patients, because many of them do not. And the GP practice should be open from Monday to Friday from 8 in the morning to 5 in the afternoon. So that's should be any practice. So especially when you have an emergency, even when they are on a lunch break, they should have their emergency telephone line on. So they should always answer within, let's say, 1 minute or half a minute. In our practice, we chose to be open for a bit longer time, so we are open from 8 in the morning to 8 in the evening. And we do take new patients. So if you feel you want to come to us, then you're more than welcome. But well, what to do in the evening hours, and the nights, or even weekends, then we have an emergency service for the GPs that's called doktersdienst. And that doktersdienst is open for those other hours. It's sometimes feels for people like it's a sort of a second GP or like a second opinion even, but that's not what they are for. So they have a nurse or an assistant as well on the telephone, and they will ask, really, is there an emergency now? If it's minor emergency, you're welcome. If it's not, then just go to your own GP. And you can contact them by phone is most easily. So the upper number is our number during daytime, and the lower number, that's the number for the doktersdienst. Of course, the slides will be shared, and you can find it online as well. But I think it will be good to save those numbers just in case. Well, and of course, when you do not have an emergency, like regular care, then you might need preventative care. For example, a COVID vaccination. Then you may just contact your GGD, so the Public Health Services, as I mentioned before. And when you have a baby or a toddler and you need to have it checked up or have a baby vaccination, you can just contact your consultatiebureau. The consultatiebureau, that's like the youth service from the Public Health Service. And they're located in many places as well in Groningen. But some whole other things, for example, the breast cancer checkup. For that, it's connected to the bevolkingsonderzoek. That's a different institution in the Netherlands. They will come once every couple of weeks to do the breast checkup and breast scans, X-rays for women. And where you're allowed to go there, then you will receive a letter at home. And all other preventative care, for example, pap smear tests or colonoscopy indication tests. So not that the GP does a colonoscopy, but the pre-test. Or diabetes care, or people with higher cardiovascular risk, or asthma, or COPD, or other illnesses, they're always connected to your GP. And it counts as well for like any other non-emergency symptom or medical question or complaint. Just go to your GP. The GP can answer most of your questions yourself, about 90 to 95%. And if necessary, they will just refer you to a different specialist, and they can always help you. Well, who is a GP? Well, I'm one of them, but there are many. And what's all the same is that it's a medical doctor. That at first. Of course, you have your 6 years of university education at your medical school. And most of them gain another years of additional training to get some more medical experience at the hospital or at an elderly clinic or in another GP clinic, just to get to know the practice. And thereafter, you have your post-academic training, which is 3 years, of which is 2 years in a GP practice and 2 different practices, so you get to know some differences as well. And you have 3 months elderly care, 3 months psychiatry, and 6 months on an emergency room in a hospital. And whenever you are a GP, then you have to do a regular skills update and re-registration every 5 years again. So as long as you are a GP, you have to stay focused and stay educated, and that's, I think, a very good situation. And what does a GP do? Well, first, you cannot visit a hospital without referral. So a GP is mostly seen as a gateway to specialized care and coordinates the healthcare for you. And as I said, we try to be the central role in medical care in the Netherlands and are mostly your first point of contact for both your physical and your mental health. And we try to take care of most of your questions ourselves, both for children as well as adults and elderly. And that's slightly different from many other countries because, for example, a pediatrician is only when a child needs really special needs or has special conditions. And for the regular conditions like having a cold or having asthma or having even a pneumonia, the GP can diagnose and treat that in most cases. So only when it's very severe, we refer the child to the pediatrician. And the same counts for a gynecologist, for example. In many countries, women just go for a regular checkup to the gynecologist. But in the Netherlands, that's not the case. You can just go to your GP and they will help you. Well, we do provide minor surgical procedures and gynecology procedures like IUDs or implants or those kind of things. Well, as I said, we do preventative care, that's regular care as well, and those minor emergencies. We do prescribe medication, of course, and we collaborate with pharmacies. In our case, we collaborate with all pharmacies in the whole Groningen, so it doesn't matter where you are. And the practice consists of a team, most cases, a team of doctors and physician assistants, nurses, psychologists, like the POH-GGZ, and assistants. Well, it's good to know that in the Netherlands, most people do have like their own GP. And therefore, if you come to the Netherlands, I would highly suggest you to register to a nearby GP as well. And you are free to choose your own, as long as it's like a maximum of 15 minutes drive from your home. And that's because when there is an emergency, for example, you fell from the stairs and a GP has to come to your home to check you out, then we are not allowed to go to patients who regularly live more than 15 minutes, because that's a too long drive to come to a patient. Then it can be dangerous for patients if it takes a longer time. So please register as soon as you're settled, even though you do not need a doctor right away. It's just good to have one. But well, how to choose them, because there are a lot of them, of course. So I think, especially in these times, just check online. Google it. General practitioner is called huisarts, so you can just Google on huisarts if you want. But I think it's good to have some proper reviews as well. So ask friends, other internationals, like how are they dealing with healthcare insurance, for example, but because not all GPs work with foreign healthcare insurances. For example, in our practice, it's no problem at all. We can just allow everybody to come, but some practices do not want them. Only when you do have like a Dutch healthcare insurance. So it's good to have those reviews from other internationals. I think that's best for you. Of course, read the website of the practice just to know some more about the practice. And of course, you can just call the practice and ask about policies, for example, those concerning the medical care for internationals and those healthcare insurances. And it's good to know that signing up with the GP is free. Yeah, GPs are not allowed to ask you for money just to register. And what is optional, but might be a good one, to have like a consultation to get to know the GP and get to know the practice and maybe explain something about yourself, your personal health, maybe some cultural differences or things you want to share with the GP. Well, if you do want to have medical care or you want to have that appointment to get to know each other, in most practices, you do have to make an appointment. You cannot just go there and wait and see until somebody helps you. And that's not common. It's common to make an appointment beforehand. So check the website, practice website, I'm sorry, whenever you can call, because that's not the same as well in all practices. Some practices are not open all day for regular phone calls. And when you call, be prepared for a long waiting time. Some practices, they take like 15 to 30 minutes wait until you get to the assistant. Well, in our practice, we try to make it a little bit easier. So in our practice, it is possible to walk in for like the minor things, for example, earwax cleaning or a stitch removal, wart treatment, blood pressure measurement. Those kind of things you can just walk in. But for the other things, like an appointment with the nurse or the POH-GGZ or one of the doctors, it's still best to schedule an appointment. Otherwise, you might have to wait for a long time. And of course, when you have a minor emergency, like a bleeding wound or something, of course, walk-in is possible. But it's best to call beforehand, because then we can reschedule some other patients so we can help you first. Another thing, what it can be helpful is that when you do call, you get to our assistant at the phone, and they will perform a triage. And triage means that they will ask you several questions to check out how severe that emergency is, or how severe your complaint is, to check if you need to be seen right now, or even that we have to send an ambulance. or that you can be seen like somewhere later today, or maybe in a couple days when it's not that severe, but you do want to see a doctor. And when there is time, it is of course possible to have your personal preference for a time in a day, or even for a doctor. For example, if you prefer a female doctor or a male doctor, you can just ask at the telephone to be helped with such by the doctor of your preference. And if you want to check out who the doctors are, you can just simply visit our website, huisartsgroningen.nl. You can just check out which doctor you want. Well, here are some of those contact options. So if you want to call us, we're open from morning 8 to evening 8 on our telephone number, which is stated here. You can even walk in from the same hour, so from morning 8 to evening 8. And online, of course, we have a possibility as well. It's like our digital doctor's assistant. A bit easier, it's assistant at huisartsgroningen.nl. If you go there, you can just schedule an appointment online. It's 24/7, of course. This is what the assistant looks like. You can just click on English and then they will help you further with that. Here we can see how to schedule an appointment. You can click on English as well in the upper column. Only what I see is that the days are in Dutch. So maandag, dinsdag, woensdag, Monday, Tuesday, Wednesday. It's all in Dutch, but I hope you can manage to work around that. Well, when you schedule an appointment, what to expect from a GP? Well, I was wondering, have you ever visited the GP in the Netherlands already? Maybe we could do a short poll question. I think I have to enter the question here. You visit. So, well, now I've done the poll. Yeah, publish. So 60% already visited, or 50-50. Okay. Still some votes going on. So a couple more people did not. So then it's at least helpful for now. I'll close the poll. Well, what do we expect from a visit? Well, in our practice, this is the main waiting room when you enter the practice, and there is a desk you see and some chairs to sit on while you wait. Well, best in most practices is first start with reporting at the desk that you're there, so they know that you're there and they can ask the doctor to come. Sometimes something has to be arranged, like healthcare insurances or those kind of things. And thereafter, you can just take a seat and wait for the appointment, of course. Well, here you see our office. So these are the consultation rooms. Yeah, and of course, me, for example, as a GP, or one of my colleagues, of course. Well, what you have in most practices are 10-minute appointments, and that's quite short. But still, most practices in the Netherlands do have 10-minute consultations, and if you want to have a double consultation, like 20 minutes, then in most practices you do have to call beforehand and ask specifically for a double consultation. For example, if you've two questions or like a more complex situation you want to explain, or you expect to have like a language barrier, then it's best to call beforehand and ask for a 20-minute appointment. But in our practice, 20 minutes is standard, so I think that's helpful. But I think it's good to know that it is quite typically Dutch to be a little bit direct or even blunt, and that's something what can happen with the GP as well. So it's don't be offended with that, but that's a bit typically Dutch, I guess. So we're quite to the point and direct. It's good, I think, to first think about your question, like what do you want from the GP? What do you expect from it? And it would be very helpful to write down your questions and your concerns, because then you are sure that you have those points handled during that consultation. It is normally allowed to bring a friend to a consultation if you want, or like a family member. It might be even helpful if you bring like a Dutch friend if you want some extra explanation, for example, about the healthcare situation or your specific personal situation. So that's normally allowed to bring somebody else. And it might be good to know that it's only you can decide to have your friend in the room whenever you have your conversation, but when you have your physical exam, that you can ask your friend to leave the room for a while for your own privacy, of course. That's quite common. So a couple of tips and tricks. Check Google or choose a GP, Google Huisarts, beforehand. Read the website of the GP carefully, and optional, do have a consultation to get to know the GP and explain a bit about yourself. When you want to visit the GP, it's best to schedule an appointment, for example, with a web agenda, the phone, or walk by at the practice. First, write down your questions and concerns before you go to the GP, and you may bring someone else to your consultation. Well, as I said, you're more than welcome to visit our practice. We can provide your help whenever you want. If you want, it's best to register at our website, huisartsgroningen.nl. And then, I hope to see you in good shape, of course, and not with an emergency or so, but you're always welcome.